Good morning, everyone, and welcome to today's Return to Campus conversation. I'm Sharon Martin, Vice President for University Relations and Enrollment Management. This is our fifth in a series of conversations we are holding to answer your questions regarding WVU's Return to Campus this fall. Today's conversation is going to be focused on public health and safety and the measures we are taking to protect our community as we arrive back on campus. We have three panelists joining with us today. Joining me are Dr. Clay Marsh, our Vice President and Executive Dean for Health Sciences, and he's also served as West Virginia's Coronavirus SAR. We also have Dr. Jeff Coben, our Associate Vice President for Health Affairs and Dean of our School of Public Health, and Rob Alsop, our Vice President for Strategic Initiatives. Earlier this week, a letter was distributed outlining specific steps on how we will approach public health and safety. Each of our panelists will review that information and clarify details. And of course, we'll answer as many questions as we can today. As the slide notes, we will provide an overview of public health and safety needs, as well as an update on COVID-19. We'll be talking about self-monitoring, contact tracing, steps to take if someone tests positive, and metrics that we are monitoring. We will also walk you through the testing process that all faculty, staff, and students will need to take before returning to campus. And we will follow our typical campus conversation format today. Our panelists will share a brief presentation, and then we will move to our open question and answer session. This session today will last until 11:30 to accommodate as many questions as possible. We're using the Zoom webinar platform for today's discussion. And so before we begin the presentation, let's walk through some of the features to help you experience today's discussion in the best ways possible. To view closed captions or subtitles, click on the CC button in the bar at the bottom of your screen. If you have questions, please use the Q&A function also at the bottom of your screen. When you click on that button, a separate screen will appear in which you can type your question. If someone else submits a question that interests you, just click on the thumbs up icon next to the question to let us know it's a popular topic. And please note, as this is new, we will not be answering any questions until after the presentation. If you have issues with audio or video at any point during today's conversation, be sure to check your personal Zoom settings. And if issues continue, you can email us at campusconversations@mail.wvu.edu, and we'll monitor that throughout the feed and, and try to help us provide as much help as we can. We'll also answer as many questions as we can live following the presentation. We've also received many that have been emailed to us prior to the session today. So please listen to the questions carefully, as we have compiled many based on a topic. So although it may not be your exact question, it will address your concern. In addition, we have moderators with us today. They will also answer questions via typed response in the Q&A after the presentation. And you'll see those responses in a separate tab from the unanswered questions in the Q&A box. All right, so we're ready to begin today's conversation, and I'm going to begin by addressing the concern that is on many of our minds, and that is the increase of cases that we are seeing in Morgantown. So we're going to begin with Dr. Marsh. And Dr. Marsh, if we can begin with having you share an update about COVID-19 nationally and what we're currently seeing in our own community. So with that, I'll turn it over to you.
Thank you, Sharon. It's really great to be with everybody today, this morning. And as we look at what's going on with COVID-19 in West Virginia and look at what's going on with COVID-19 in the United States and in the world, we see that despite our hopes that with a warmer climate and ultraviolet light from the sun, which we know in laboratory conditions reduces the ability of COVID-19 to infect people, that in fact we are seeing COVID-19 spreading. So just a really quick statistic, which I think is interesting, that it took 99 days for the United States to reach 1 million people who were tested positive for COVID-19. It's taken 43 additional days for that number to get up to 2 million. And most recently, yesterday, we passed the 3 million mark, and it took only 28 days to cross the 3 million threshold. The US makes up 4% of the world's population, but about a quarter, about 25% of the COVID positive cases in the world, and about a quarter of the COVID positive associated deaths in the world. So as we look at the country, we know that COVID is spreading, particularly in the southern part of the country, in South Carolina, in Florida, in Texas, in Arizona, and California. And we also know that COVID has been spreading in many, many other states. And in fact, we have seen an uptick in West Virginia as well. Now, what does that mean relative to the rest of the country? So yesterday, I believe there were 98 deaths or 97 deaths in Texas, which was their highest, I think, single day total. West Virginia has had a total of 95 deaths from COVID so far. Now, that's still 95 people that have died, but relatively speaking, we have been very, very good at controlling COVID-19 in West Virginia. There's an author, his name is Thomas Puyo, P-U-E-Y-O, who's published a series of articles in a journal called The Medium. And Puyo is not an infectious disease person or even a medical person, but he's a really smart engineer, and he does a lot of work with data. And if you have questions about COVID, I would really point you toward his articles in the journal The Medium. But he basically points out, if you look across the world and look at countries that do well with COVID, then generally their rate of positivity, all the people tested who are positive, should be less than 3%. Because being less than 3% gives you the opportunity to continue to identify those people infected very quickly and then do the contact tracings, which you'll hear about. But really all that is to find out the people that they are most closely contacting, most closely connected with. And Dr. Coben will talk about some of those criteria. But despite us worrying about infectivity with COVID, it's interesting to find even in households where people live with others with COVID-19, the transmission rate is really only overall about 20%. So it would say that despite COVID-19 being a significant problem, it's not that we can't mitigate that problem with really smart maneuvers. And I want to turn to talk about how we might protect ourselves and protect each other. And when you look around the world at countries that have done a really good job at protecting their people from COVID-19, we really look at the Asian countries. And I want to pick out two. One is Hong Kong and the other is Japan. And the reason why I want to focus on those two countries is because Hong Kong has a population of about 7.5 million people, which is close to a comparison country, Sweden, that has a population of about 10 million people. And on a density level, a number of people living in a very tight physical area, Hong Kong actually has more people jammed into a smaller area on a proportional basis than Sweden does. The difference is Hong Kong really adopted wearing masks very quickly, and Sweden didn't. And what we find is in Hong Kong, we see less than 10 people die from COVID so far. And in Sweden, we've seen about 5,500 people die. Similarly, if we look at Japan, which has a population of about 130 million versus the US population of 330 million, Japan has seen less than 1,000 deaths. And on a proportional basis, if you basically use a mathematical correction for the population differences, then you have a 2% chance of dying in Japan versus dying in the US from COVID-19. So we know that masks work. We know that physical distancing works, 6 feet or more. And we know that covering our eyes, washing our hands, covering our sneezes and our coughs all work to reduce the spread of COVID-19. Because as we have learned, the spread of COVID-19 happens from person to person and generally is transmitted by droplets as we talk or breathe or sing or cough or yell. And so we've found out that masks are really important. Japan, which doesn't do nearly as many mitigation strategies, not as much contact tracing, et cetera, they basically live by avoiding the 3 C's. And this is a pretty easy thing to remember. Avoid closed indoor spaces. Better to be outside than inside because you have a much broader amount of air to disperse droplets and aerosols that can transmit COVID-19. Number two, avoid close, constant contact with people that you don't live with all the time. That means stay physically distanced 6 feet or more, and avoid greater than 15 minutes of constant contact with people that you don't live with. So don't stay in one place inside with people. And number three, avoid crowds. And so if we avoid these three C's, closed indoor spaces, close constant contact with people that you don't live with, and crowds, then we are going to be advantaged. And when we look at the US and look at what's going on in the US, what we find is that there is data for states that have done things certain ways and how that's affected the spread of COVID-19. And in fact, when you look, this is from the National Governors Association, when you look at states that basically have no executive orders, no rules about wearing masks, then those states on average have seen an 85% increase in the number of people infected with COVID-19. In contrast, when you look at states that have basically made rules to say employees of businesses, particularly indoor businesses, are mandated to wear masks, we see that there's still a 70%, that's 70% increase in the average number of COVID positive people in those states. In contrast, when you look at orders that makes customers and employees wear masks indoors, then you see there's a 12% decrease in the COVID positive cases. And that indeed is what we have done in West Virginia. The governor has just mandated that. So it's really important that we, even though we're seeing more cases in the state, we're seeing that COVID is spreading from community sources, that we are now very aggressively mitigating against that. And while we've seen more cases, relatively speaking, we're a very safe state to be in. Our overall conversion rate of the number of people that have been tested to positive is about 1.8%, which is well below that 3% threshold I talked about. And as we start to look at some numbers that tell us that the spread is rising, these mitigation strategies with masks, with physical distancing, and with eye protection and hand hygiene, which you'll hear about that the university has been very aggressive about doing, and the state of West Virginia is being very aggressive about doing, will, I believe, make a big difference. So Sharon, back to you.
All right, great, thank you. Let's go next to Dr. Coben.
You're muted.
Oops, you're still on mute.
Got it.
There we go.
Thank you, Sharon, and good morning, everyone. I want to begin by reiterating what Dr. Marsh said in terms of the fact that we are very aware of the situation on the ground in Mon County, and that we are continually adapting our approach in light of that evolving situation. In just a few minutes, I'll further describe our ongoing data monitoring process and how we've already made some adjustments based upon those local conditions. But I want to first spend some time talking about monitoring your own health. So Rob, if that slide can be put on, that'd be great. During this time, it's especially important that we all pay attention to how we're feeling and not just try to push through any illness and come onto campus. We ask everyone to self-monitor, and if they have any concerns that they might be developing an illness, to stay at home and seek medical advice. Students can contact WVU Student Health for advice, and employees can contact their primary care provider or the WVU Medicine Hotline for advice. We also ask that employees check in with WVU Medical Management if they're not feeling well and need to stay home. Now, all of this information will continue to be posted on our website, so you can quickly review who to call if you're not feeling well. But in general, we want everyone to err on the side of being cautious and to stay home if they're not feeling well. And while I'm on the subject of staying home, I'll just briefly mention that we are strongly discouraging people from traveling out of state during this time, and strongly discouraging people from hosting visitors from outside of West Virginia. Several of the recent outbreaks that we've seen in Mon County and in other parts of the state have been associated with people returning to West Virginia from travel outside of the state. So reducing travel will reduce the risk to all of us. Next slide, please. The university is receiving COVID-19 test results for all those who undergo testing through any of our WVU medicine testing sites, or as a part of the initial testing that Rob will soon be describing. Any person who receives a positive test is contacted directly by members of our health staff. They are given information and instructions on what to do, what not to do, what to watch out for. And we also start to try to determine who they've been in recent close contact with. Once that's completed, the information is entered into a secure and confidential database, which triggers an immediate alert that is sent to our local health department, to our student life team, our medical management and human resources team, and our facilities team. The different members of these teams will then reach out to provide additional necessary support. For example, representatives from student life would reach out if the case involved a student who may need to move to a place where they can be better isolated for quarantine. Next slide. I want to briefly discuss the topics of case investigations and contact tracing. Formal case investigations and contact tracings are activities that are completed by local health departments. Of course, we at the university are assisting the local health departments in these efforts. With contact tracing, what the health department is trying to do is to identify people who've been in close contact with COVID positive cases so that those people can be placed into quarantine and monitored for the development of any symptoms. Close contact is defined as having been within 6 feet of someone for at least a 15-minute period of time. Casual contacts or brief contacts are not considered to be at risk, and those individuals are not placed into quarantine. Now, earlier I mentioned that we've been keenly aware of the situation on the ground in Morgantown and elsewhere throughout the state, and we're continually adapting our approach based on those local circumstances. So as most of you know, earlier this week, we did experience a significant influx of new cases in Mon County. Because of this, the local health department fell somewhat behind in their ability to do rapid contact tracing. That's why on Monday, we issued interim guidance that recommended anyone who had been in a confined space with a positive case for 15 minutes or longer enter into a quarantine period because the contact tracing could not be rapidly conducted, rapid enough to determine who may have been within a 6 feet distance of positive cases. So we erred on the side of caution and recommended a more conservative approach to quarantine until such time that the formal contact tracing could be completed. We will continue to issue updated guidance in the days and weeks ahead as the situation continues to evolve. Next slide. I'll finish by talking a little bit more about that database that I mentioned earlier and how we're using that and other sources of information to continuously monitor the situation in Morgantown, Beckley, Kaiser, and throughout the state. For the past several weeks, we've been building, testing, and using this data system to record all positive cases. Over the next few weeks, we'll be using this data to also create a dashboard so that everyone can see some basic information on the number of positive cases amongst university students and employees and how those numbers may be changing over time. In addition to monitoring the number of positive cases, We have been and will continue to closely monitor the percentage of cases that, percentage of tests that are positive, the county-specific incidence rates of COVID-19, the county-specific R values, which tracks the rate of transmission of COVID-19, and information on hospitalizations and hospital capacity in our region. We may also start to generate university-specific R values and incidence rates. And all of this information will be regularly provided to university leadership as a way to continually assess our local situation and make decisions on what additional actions may be needed we may need to take as a university community. So Sharon, I think I'll now turn it back over to you.
All right, great. Thank you very much. And we'll now go to Rob Alsop.
Good morning, everyone. I'm going to spend the bulk of my time talking about testing, but I want to spend just a minute following up on Dr. Marsh and Dr. Coben in talking about the overall landscape and how testing fits into that. You know, several weeks ago when we started preparing in earnest for our fall semester, we knew that as we came towards the fall, we would still be dealing with COVID. We didn't know whether the environment would be better or worse. And so we've worked on a number of strategies at the university, working with our healthcare professionals that are designed to reduce the incidence of infection and to reduce the spread. And so we've designed a number of strategies, and Dr. Marsh talked about the importance of masks. And so we have a university requirement that when you're on our campus, you need to wear a mask. We've talked about PPE. We've talked about what we're going to do in a previous campus conversation on those topics. And testing is an important component of that. But there's also a part, even relating to testing, where we really need your help. And so if you're a student, if you're the parent of a student in providing counsel or a family member for that student who's coming to campus, or you're an employee or a member of our community that's going to be on our campus, I just want to give this analogy. Coach Huggins often talks about how he doesn't determine his players' playing time, they do. And so while Coach Huggins provides that guidance and that leadership, just like Dr. Gee and Dr. Marsh and Dr. Coben, and what our best practices are, how successful we are in working through the fall is really going to be dependent on personal responsibility and personal accountability. It's really important that you take seriously what we are requiring and the guidance we're providing, because Clay indicated there are some things that we can do that really make a difference in dealing with this pandemic. And so again, that personal accountability and mountaineer spirit of taking care not only of yourself, but taking steps personally to keep other folks from getting illness who may have underlying conditions or may be more susceptible to getting really ill is really going to determine how successful we are this fall. Testing is an integral component of that. We believe that an initial test and ongoing surveillance testing is going to be critical as we deal with this pandemic this fall. To that end, the university will be providing free of charge a test to all of our students, faculty, and staff who are returning to WVU campuses and provide, again, continued testing throughout the year. I want to note that if you are exclusively online and not returning to one of our campuses, or an employee who's working remotely this fall, we will not do that initial test. If you are taking all online courses, but you are still on our campus in Morgantown, we want you to get that test. You'll receive an email to your WVU account containing a link to register for testing at the preferred date, time, and location. Additionally, you'll be required to consent to that COVID-19 testing program terms of services and complete an online pre-test questionnaire. If you're under the age of 18, a parent or guardian will need to complete this process for you. There's two different types of tests. Well, there's several different types of tests, but there's two different varieties that we talk about. One is one that tests for a live virus and one for an antibody. The initial testing that we will be undertaking will be for a live virus, and we will do it through a nasal anterior swab test, which is less invasive and takes less than 5 minutes to complete. Again, all of these tests will be free. As shared in our letter, and as I just indicated, this test is required. For students, failure to take the COVID-19 test will result in a $250 fee being added to the student's account. But that's not all. This is not a way for a student to buy out of a test by paying a $250 fine. The student will also be referred to student conduct for appropriate disciplinary action. We've set this up to make it easy to take a test, and our goal as our students and faculty come back to campus is to identify those who are either symptomatic, pre-symptomatic, or asymptomatic to take appropriate quarantine and isolation steps as we return to campus. If we do that and we accomplish this initial test for everybody, we're going to have a real leg up in stopping incidents of the spread of this infection. For employees, if you fail to take the COVID-19 test by August 15th, you will be subject to employee disciplinary actions until you take the test, which could include and will not be limited to placing you on administrative leave without pay or placing you on administrative leave while requiring the use of annual leave. Again, there's 2 or 3 things that we really need to do this fall that can help turn the tide. This initial test and our surveillance testing are a key part of that. I also want to note as a corollary, we will be, Dr. Marsh mentioned the requirement of masks on our campus and their importance. There will also be disciplinary measures for our students and our staff who fail to wear a mask or a face covering on campus. That can include a written warning, removal from class, a reduction in grades in classes, probation, suspension, or even expulsion from the university. Employees will also be subject to discipline for failure to comply with policies relating to masks and PPE. So as we ramp up, we will be doing these testings over a period of several weeks in the run-up to campus. All students, faculty, and staff will be required to schedule a test time slot that's most convenient for you. Again, you will receive an email to your WVU account containing a register to link for testing at your preferred date, time, and location. After you've completed the scheduling process, you will receive a confirmation email as well as a reminder email 48 hours in advance of your selected time slot, again on the day of. On July 13th, we will begin emailing our Morgantown faculty and staff. July 20th, we'll send an email to our Morgantown students. July 27th, an email to our furloughed employees. And on August the 3rd, an email to our Beckley and Kaiser students, faculty, and staff. I do want to indicate that for our scheduling capabilities, there are limits on when you can sign up to schedule so that we don't overload the system. We ask you to wait for and watch for the email that we send to you for when you can register. The testing schedule for Morgantown. We've worked on multiple test sites and locations around all of our campuses for your ease and convenience. We'll begin our testing for our faculty and staff on Monday, July 20th through Saturday, July 25th, 9 a.m. to 4 p.m. at the WVU Coliseum. This will be drive-through testing, similar to what they have at the University Town Center for our WVU medicine colleagues. We'll also be doing testing August 27th through August 1st at the same location, and again from the 3rd to the 8th on that. And our provider for that test will be Q Labs. It's an organization that we've been working with for several weeks based out of Charleston. For our students, we have a number of locations, and we will start testing our students on Monday, July the 27th. We will have locations at the Mountain Lair, the WVU Student Rec Center, and the Erickson Alumni Center. And you can see here that we will have these locations running for several weeks as students return to campus. Our test provider for these tests will be Quest Diagnostics. And again, similar to Q Labs, we've been working with Quest Diagnostics and making sure that we feel really comfortable about the accuracy of the testing about the protocols for the testing, about your privacy, and that we make sure that our partners understand the importance of the turnaround time for these tests, and that we work together in the best interests of the university. For our divisional campuses, for students, faculty, and staff, we will be doing our testing, for Potomac State, August 13th through the 15th. And that will be at the J. Edward Kelly Complex parking lot, and that will be done by Q Labs. For our colleagues at WVU Tech in Beckley, we'll be doing tests from the 11th to the 13th and 2 sites, the Van Meter Gym and then the LRC parking lot. And our Q Labs partner will be undertaking those tests as well. The testing procedure will take less than 5 minutes to complete. Our team has worked through protocols for security, for different lanes, for the personal protective equipment that we'll have for our employees and colleagues at the National Guard, local healthcare providers at WVU Medicine in our community going forward. You need to wear a mask to your appointment and arrival time at your designated location. Upon your arrival, you will check in and verify your information. You'll be asked to provide your Mountaineer card and or your WVU ID for a student or employee number. WVU test providers will perform whether Quest Diagnostics or Q Labs, will perform a nasal live virus anterior swab test, again, which is less invasive and results in less discomfort than sampling from other upper respiratory anatomical sites. After the test, you'll be directed towards an exit and be given a welcome back kit that includes a cloth mask or a gaiter, disposable masks, hand sanitizer, and a key touch tool. So after the test, we will ask you to maintain social separation as much as is possible and avoid large gatherings to the fullest extent possible until the results of your test are available. You can leave your residence hall room, but you should wear a mask or face covering as mandated and stay physically distant as much as is possible. Students should be able to eat within the dining halls, but they should wear their face mask covering and physically distance themselves while traveling to dining halls and when they're not eating. During this period, we will have a number of virtual activities that will be hosted for our students to stay busy, meet people, and ramp up as we start our semester. For our faculty and staff, they can leave their offices and workspaces, but should wear a mask and face covering as mandated and stay physically distant as much as is possible. As we know, again, during the early stages of this virus, and even as its onset, a lot of folks stay asymptomatic. And our goal through this initial testing process is to identify as many of those individuals as we can to make sure that they have adequate health care and to make sure we do appropriate isolation and quarantine practices for them. Until you get your test result back, we again encourage you to just use extreme caution in avoiding crowded places and focusing on avoiding Clay's 3 C's that he walked through. You should receive your test results within 3 to 5 days, depending on the lab workload. Morgantown students will be able to review their tests online by creating an account with Quest. Employees on all of our campuses, Potomac State students and WVU Tech students will be given a registration number from Q Labs, which they can also review their results online. Students, faculty, and staff with a positive test result will be contacted by both our student health services and the local health department, and actually also by our WVU Cares team within student life. As Jeff mentioned, positive test results will be communicated by local health department officials to WVU officials, and we will then work with our local health department to conduct contact tracing and decontamination as appropriate and cleaning as we move forward. We take your privacy seriously. Testing information regarding patients is regulated by HIPAA, and we will keep your information confidential, consistent with those guidelines and local health policies. In addition to the initial testing, the university is committed to providing testing throughout the year, focusing on 3 major areas: rapid testing for anyone who exhibits symptoms, frequent ongoing testing for groups that may be at higher risk, such as those living in residence halls, participating in athletics, and those in the performing arts. We will have ongoing surveillance testing throughout the campus community during the school year, and that may be both the live virus and antibody testing as we move forward and technology continues to improve and be implemented. Our colleagues at our Health Science Center are rapidly working on internal testing from the university that as we get into the semester, we should be able to ramp up and increase not only the amount of tests that we can do, but also the turnaround time. Once the initial phase of testing everyone is complete, we'll begin preparing for the subsequent testing for these major groups. Now we know that there will be a number of accommodations for the fall relating to medical conditions. We know that some members of our university community or their family members may be vulnerable to complications of COVID-19 that have increased the risk of infection or the severity of symptoms. Medical conditions that necessitate reasonable accommodations related to COVID-19 are being addressed in accordance with the Americans with Disabilities Act. We'd ask that our faculty and staff send inquiries to the coronavirus modification at mail.wvu.edu, and more information can be found at diversity.wvu.edu. Students should send inquiries to the Office of Accessibility Services at 304-293-6700, and more information can be found at accessibilityservices.wvu.edu. And Sharon, before I turn it back to you, just to reiterate again, we know from the science that dealing with the pandemic is going to be something we all need to work together on. We also know that these things like testing, when you're not feeling well, stay away from others and contact your healthcare provider. Wearing masks, using good hygiene practices will help us work through this together as we continue to monitor the situation on the ground and determine what mitigation measures we need to continue and what modifications we need to make sure that we provide a safe environment for our students, our faculty, our staff, and our community as we move forward.
All right, great. Thank you, Rob. And so now we're going to move to the conversation point of today's discussion. We'll begin taking your questions and providing some answers. As a reminder, please use the Q&A function at the bottom of your screen if you have questions. And when you click on the Q&A button, you'll see a separate screen, and that is where you can type your question. Moderators will be answering questions now and sending questions to me to address live. And just a reminder that this conversation is focused on public health and safety. If you submit a question that pertains to another topic, we will save that for a future conversation. And also a reminder, we may not be able to address every question today. There are a lot coming in, but remember that we do have our Return to Campus website. We'll be updating that frequently, and we'll have an FAQ there that you can refer to later. So let's begin our questions. And the first one, I'm going to actually pitch to Rob. So we know that several people heard this news yesterday and have some concerns. Our governor, Jim Justice, mandated that West Virginia public schools not start until September 8th. What does that mean for WVU students?
So the university is monitoring the public health situation closely. At this point, we are continuing with plans to return to campus with all of the safety measures in place that we are discussing today. As we've indicated from the beginning, the public health situation will ultimately dictate our course of action. The next few weeks will be critical for us to monitor. And you know, Sharon, one of the things that we're doing in working with our health officials is looking at the positives and negatives of being online versus being on campus and weighing those and how we can develop mitigation strategies to try to determine the best path forward. We know that the landscape is changing, and so we are prepared over the next few weeks to monitor that and make the best decision for our university community.
All right, great. Thank you, Rob. Dr. Coben, these next two questions are for you. This goes back to what happens if someone tests positive. So let's just reiterate the things that we talked about during the presentation. If I am a student and I test positive, what do I do?
Okay. So first, everyone should realize that you will be contacted. You'll be contacted directly by members of our student health services. And you will also be contacted by the local health department. Students who are positive should stay in their residence, should wear a mask, and should separate themselves from other individuals. They'll also be given specific instructions on how to receive care, what to watch for, what symptoms to watch out for, who to call in the event that their symptoms should worsen. And they will also receive follow-up information from our care team and student life in terms of how they can get meals delivered to them, whether or not they might need to isolate from others in their living facilities. So that's what should be students would expect.
All right. And what if I'm a faculty or a staff member and test positive? What should I do then? How does it differ from students?
So similarly, faculty and staff will be contacted by both members of university health services and by the local health department. We similarly ask them to remain at home, isolate themselves from others, wear a mask. We also would suggest that they contact their primary care provider so that they can receive ongoing advice and follow up in terms of what to do and if they should feel worse during the course of their illness.
All right, great, thank you. The next question is for Dr. Marsh. So there has been some chatter about immunity to COVID-19. Can you share some facts about immunity and the COVID-19 virus?
Sure, Sharon. I just wanted to also make one comment before I answer that question. I've been looking at some of the questions online, and there's a lot of questions about safety for our students and our faculty. And I think that Rob said it really well. You know, this is a very dynamic event that's changing very rapidly. So we are watching this all the time, both from the university, from the state, and we will do what we believe is in the best interests of the people that live here and work here. And we want to open the university, but we are committed that we will do that only if we feel that we can do that safely. So I just want to make sure that we are putting that out there, because our primary concern is each one of you and your safety and the folks who work here. And from an immunity standpoint, you know, this virus is fascinating, and we're learning about the virus all the time. So coronaviruses, which this COVID-19 is a part of, are seasonal viruses that give us colds. And so from that end, it would be kind of implicit that we don't develop immunity that will protect us year in and year out from other coronaviruses. What we're finding out from COVID-19, at least in a group of people that are being studied, is that most people do develop an immune sort of capability when they recover immediately from COVID-19. But it looks like that immunity might be dropping off after several months. So there's a frame called herd immunity, which is a way to basically look at a group of people in a population who have had the infection, like chickenpox, and then who are not able to get the infection again. And that's been a strategy that countries like Sweden and the United Kingdom initially tried to do with COVID-19. In Sweden, they found, despite basically no mask and letting their healthier people kind of go out and perhaps get infected that they thought would be safe, and then get that herd immunity, which requires about 65 to 70% of the population have immunity to that infection, that they have had a lot of people die, and they only have 7% of people that demonstrate that immune function against the virus. So we know now that going that level is probably not what we should do, which is really the reason why masks and physical distancing and protecting ourselves and each other. Remember, masks don't necessarily protect you from somebody who's infected. It protects somebody else from you who might be infected, as we know that about 50% or maybe more of the spread of COVID-19 happens from people that are either pre-symptomatic, that are not symptomatic yet, who will get symptoms, or perhaps people that won't ever get very much in the way of symptoms. So we should treat ourselves and each other when we go out like we could have the infection, And by wearing masks, we reduce the droplets that we produce and the aerosols, those fine, small droplets. And that actually reduces the amount of COVID-19 that is in the environment, which reduces the infectability of the disease. So from an immunity standpoint, it doesn't look like we're going to get lasting immunity from one infection from COVID-19. And so likely when we get a immunization, which gives us immunity, we'll have to have that immunization most likely yearly, I would guess.
All right, great. Thank you, Dr. Marsh. I'm going to follow up with you on another question that was raised that pertains to your last answer. And it says the definition of close contact on the Return to Campus website includes a time period of 15 minutes of potential exposure. Is this time period based on scientific studies? And if so, do these studies take into account the fact that the virus can be aerosolized?
So the answer is yes and yes. So it's interesting when you look at other aerosolized infections, and tuberculosis is actually probably the prototype for aerosolized infections. There were studies on a submarine, and they looked at the person who had TB in their bunk, and they could actually track the infectability based on the distance away that people were from that bunk, where they were basically positioned on the submarine, which was a forced kind of, closed space. We talked about the 3 C's. And as you get away from the person with the virus, and in Asia, they even basically go down to 3.2 feet, 1 meter. So their close contact is 1 meter for 15 minutes. And so as we look at studies that have been done that look at infectability, like I said, even people that live with somebody who's COVID-19 positive only on average get infected 20% of the time. So that means 80% of the time, even if you're living with somebody who has COVID, you're not getting infected in the same house. So I think that we don't want to undermine or underestimate the infectability, because we know COVID is a very infectious problem. But if we stay outside more than inside, and if we all wear masks, 80% of people wearing masks and staying physically distanced 6 feet or more will give us an effect on that R value, the reproductive score, the R naught, or the RT value that we talk about, that will be approaching what we will get with a vaccine. So we know that these mitigation strategies, these environmental strategies, protecting ourselves and each other is really important. And so significant contact is pretty close for a sustained period of time, which is one of those C's. So that's a reason why people should be very cognizant when you're out, stay distanced, wear your face mask, and if you do that, wash your hands really well, then I think that most of us can feel pretty comfortable that we will be much less likely to be infected with COVID-19, even if we have somebody that we are around who we know who has it, if we limit ourselves to those 3 C's.
All right, great, thank you. The next question is for Rob. So Rob, there's some folks who are sharing that they know all these protocols have been put into place, but how can we trust our students to follow these protocols? Oops, you're on mute.
So as I mentioned before, a lot of this is going to come down to personal accountability and responsibility. And so we will continue to educate our students and our faculty and our staff that they need to follow these rules because it's the right thing to do for themselves, not only others. We know that there'll be others who, from time to time may say that they don't want to wear a mask or it's not important to take a test. And so we do plan to have several enforcement mechanisms for that, in addition to the educational component. So, for example, for mask wearing, if an employee or a student fails to wear a mask on campus, they can be referred to student conduct and ultimately removed from a class, have their grade reduced, be suspended or expelled for repeated failure to wear a mask. For employees, there can be progressive discipline leading all the way up to suspension or termination as well. In the classrooms in particular, our faculty will be empowered to ask students or remove students, tell students they need to leave the classroom if they refuse to wear a mask. Additionally, for places like the mountain lair, we are going to have individuals stationed at key entry points in some of those larger buildings like the mountain lair and the crossings to remind students to put their mask on, as well as to have a ready supply of masks going forward. Additionally, we covered this a little bit in our last campus conversation. We plan to have masks stored in buildings and in key locations across our campus so that they're easy to access, so that if a student forgets a mask or an employee forgets a mask, they'll be able to get them. We'll have them to hand out as students walk into the mountain lair so that they do not, if they don't have one with them at that point in time, they'll have no excuse not to put them on. So generally it'll be education. It'll be a ready supply that will be available, present for students and our faculty and staff. And then there will be a disciplinary component for those who refuse to abide by our rules.
All right, great. Thank you, Rob. Dr. Coben, this next question is for you. It says, the announcement on Tuesday said students will be instructed to self-isolate until they know the results, but that will take 3 to 5 days to get those results. Please provide details on how isolation will be enforced among the students, particularly in the residence hall. And I might add, maybe we also help define self-isolate versus quarantine.
Yeah, sure. So Rob covered some of this during his presentation as well. We're not imposing an isolation or a quarantine in the strict public health sense of the words in these cases. The people that we're testing in our initial testing are asymptomatic. Certainly for anyone that is symptomatic that receives a test, we would certainly isolate them. But in our initial testing, we are testing the asymptomatic population. So when we're using the term self-isolate, what we're really describing, as Rob mentioned, is we want people to social distance as much as possible during this period of time, to remain isolated from groups and from others as much as possible during this period of time until they get the results back, which differs from, as I said, the strict terminology of imposed isolation or imposed quarantine that occurs when we're dealing with positive cases and the follow-up of those contacts.
All right, great, thank you. Rob, here's a question for you. It says, if a student does test positive for COVID after moving in to a residence hall, where are they sent to quarantine?
So we have a set of apartments, Arnold apartments, that were taken offline a couple of years ago. Today, over the past few weeks, we have been putting Arnold Hall back into service. And so students who do test positive for COVID who are in our residence halls will be moved to Arnold Hall, and the folks from Student Life will help with that move and help with the student as they go through that process. And just to note, there will not be any extra charge to that student for the movement or staying in Arnold Hall during that time. So it'll be a service that we're providing to our students in our residence halls so that they can be in a period of isolation after a positive test.
Okay, great. And a follow-up with Dr. Coben to that question, if a student tests positive, can parents come and pick up their child and take them home?
Yes, that certainly would be possible. We would want to work with our local health department to make sure that they were aware of that so that that could be communicated to the health department where they might be returning to. But of course, there is some additional risk that the family would need to consider as part of that process if they decided to take that student home with them.
All right, great, thank you. And Rob, another question around testing. It says, can we get tested in our local area?
So we, for purposes of our testing and what we're requiring, we do want students, faculty, and staff to get tested at one of our test sites. We know that as people return to Morgantown, obviously they'll be traveling, and as they come in, there's a chance they could pick it up then. And so we are requiring the free test after you are in town in Morgantown at one of our sites.
All right, great. And I'm going to stick with testing. There's a couple more questions around this. I'm going to start with Rob. I know you mentioned this in the presentation, but they're asking again, who is conducting the testing and swabbing? So just want to clarify that.
Yes. So we have been working with the Health Science Center, with our WVU hospital system, with the National Guard, and with the local health department. And so we will have professionals who will, and graduate level students, let me say that, to make clear, graduate level students from the Health Science Center who will take part in the, with our testing. And so, and additionally, we are also working with some local EMS professionals as well, and, to conduct the testing, and they will have the appropriate PPE and train for the testing. I know there was an issue that came up a couple of days ago where there was a concern that we were asking undergraduate students to be recruited to serve as testers, and so that is not the case. As you might imagine, if you're in medical school or you're in nursing school at the university here at WVU, and you're taking your courses and your clinical rotations, there is a community service requirement for those students where they have to be involved in the community and helping healthcare providers to get training and part of their education. And so as part of that, we did and we have asked whether some of those graduate students who have the appropriate training and will have the appropriate training, if they wanted to participate as part of those community service requirements in this testing. And so those students, those graduate level students who would have that training may be part of our testing process, but it will not be undergraduates or others who do not have the appropriate training for that testing.
Great, thank you. And Rob, I'm going to stick with you because this next question, I think we need to clarify what students need to do after they have been tested. The question is, if students can begin being tested on July 27th, how is this helpful if they can then go back home or go on vacation after the test, but before classes start on August 19th?
So the goal is not for students to come to Morgantown, be tested, and then go back home. As you might imagine, there are a number of students who are already here in Morgantown, staying either in their apartments or that live in the Mon County area. And so for those students who are here and are going to be here in the run up to campus, those are the students who need to register early and get tested. This is not a return early and then go back home or go on a vacation for that point. And to that point, for our residence halls, for example, we are bringing students back earlier than we normally would. And so students have already started registering for early days to move into their dorms. The final point I would make for upperclassmen students is, as you come back to our community, there are a lot of businesses who are putting into place a lot of protocols for social distancing and mask wearing. And so it's going to take longer when you go to our bookstore, or when you go to the grocery store, or when you travel out to get your supplies. And so we would encourage you to make sure that you have sufficient time to return to Morgantown at an appropriate time so that you can be prepared to do everything you need to do here. And so that probably means coming back a few days early. That will also help with our testing protocols to make sure we get everybody tested that we possibly can before classes start. So again, it'll be a scheduling wave of the first students who will start testing in late July will be those who are already in the Mon County area.
All right, great. Thank you, Rob. Dr. Marsh, this next one is for you. So they are listening about practicing the 3 C's, but some of our viewers are interested in knowing how can you practice that within the residence halls or in the classrooms?
Well, I think that, you know, a lot of the 3 C's or any other actions are really around behavioral choices that people make. And I think that whether it's at the state level, the national level, or the university level, that, you know, each one of us can take a sense of personal responsibility and start to do things that make good sense. And I know that being, you know, 17, 18, 19, 20 years old and being my age, that good sense may mean something different to you at different ages. But suffice it to say that if indeed you wear a face covering when you're around a lot of other people, I mean, truly, if you're out by yourself and you're exercising and you stay a good distance away from other people, you don't need to wear a face mask, which might constrain your breathing, etc. But similarly, or in contrast, I guess, if you're at a place where there's a lot of people and you're outside, then of course everybody should wear their face mask. And 6 feet is really, if you put your arms out, you should be at the very least that distance away from somebody else. And And the farther the distance away from other people, the more benefit you get. But let's also just level set this a bit about the university or about your home or community. You know, COVID is a pandemic. It's something that we haven't seen in our lifetime, not since 1918, and it's everywhere. And I don't say that to scare anybody, but whether you come back to the university or you're just out in your own community, you know, if you're a West Virginia person, you know, in general, it's safer probably than if you're in, well, for sure, than if you're in Florida or Texas right now. But as we've said, you know, in all of our press briefings, COVID is starting to accelerate in spread in West Virginia, just like it is in other places. So whether you're here and coming back on campus, or you're here in West Virginia living in your home, or you're somewhere else, protect yourself. I mean, it's not any different. And we want people to learn this, not just so that we can get the university back in gear, or, you know, we can have our people in West Virginia feel safe only when they're here in West Virginia. We want to outfit each one of you with the tools and the knowledge so that you can protect yourself, and you can protect yourself, you know, and the people in your family that you love and your community, etc. And the real risk is the rate of spread. So for each one of us, we want to keep from getting sick, but across the country, we want to reduce that rate of spread, because you see the surge happen. And when the surge happens, you start to overwhelm the healthcare capabilities. And ultimately, right now in West Virginia, we're doing fine. And our hospitalizations are ticking up a little bit, but our ICU capacity is wide open, as is our ventilator capacity. And we watch that very carefully every day. And that is what we're trying to maintain, as well as trying to make sure that people are protecting themselves, because we don't want anybody to get sick.
All right, thank you, Dr. Marsh. Rob, this next question is for you, and it's about employees and testing. It says, what about employees who have been designated as remote hybrid, as in primarily working from home, but will have to come to campus occasionally? Will we need to be tested?
Yes, if you're a hybrid employee, a hybrid designated employee, and you will be on campus part of the time, you should get your test. The only folks that we are not taking a test are those who are continuing to work remote full-time.
All right, great. I'm going to stick with you, Rob, because the next question is the test the deep nose swab, and will it hurt?
So the test is not the deep nose swab. The test is an anterior nasal swab, which means that they will go up inside the nose, but they will not go all the way up in. I know someone's probably thinking about a test that feels like you're, for lack of a better term, poking the base of your brain. We are not doing that test. It is a lower nasal swab that we were doing. And so while I won't say that it will be absolutely pain-free, it is not the deep nose nasal swab that's the assumption behind the question.
And if I could just add, Aaron, really briefly, so it turns out that all these tests are really equally approved by the Federal Drug Administration and the Centers for Disease Control. So at one point it was thought that you needed to jam that swab way back in your nose to get a better sample, but now it's clear you don't. And somebody said the deep swabs are really uncomfortable. Somebody described it maybe like a brain biopsy. So by doing this, it becomes much more comfortable. And if we're going to test people repeatedly, which we want to make sure things are safe, then we want to make sure it's done effectively, but the most comfortably we can.
All right, thank you. Dr. Coben, this next question is for you. They ask, what metrics, for example, the number of students or faculty cases, student faculty positivity rates, county cases and positivity rates, statewide numbers, et cetera, is the university looking at to make decisions, and what is the go-to or no-go point for the return to campus?
Okay. So I'll invite Rob and Clay to also join me in this response. But I will say, as I mentioned earlier, we are closely monitoring a number of metrics. Certainly, we're looking at the number of individuals who are testing positive and how that is trending over time in our local communities and amongst our WVU community. We're also looking at the test positivity rate very closely, and we're looking at that county by county in terms of where our campus locations are. We're looking at the R values in a county by county approach, and we're also looking at the county specific incidence rates as that changes over time. Those measures are the measures that we're using. I think those are consistent with the measures that are being used not just in West Virginia, but across the state and across the nation to try to measure the risk of local communities and the spread across local communities. Using all of that and the contextual information that we're gathering, we'll be providing that regular input to university leadership for decision making. And I'll let Clay and Rob comment on how that information will be used specifically to make those determinations on where we're going to go.
Clay, you want to go, or do you want me to take off on it?
Yeah, let me just add one thing, and then I'll let you take off on the university side. I think it's important for people to recognize that Jeff Coben and Sally Hodder, who is another senior faculty leader at the university, and I are all also using these same metrics at the state level to make recommendations to the governor about what we should do, you know, for the different sort of approaches and continuing to open the different parts of the state to, you know, to potentially start to think about holding or even backing up some things. So these are metrics that we're watching. And the only other metric I would include is the hospital capacity, the ICU capacity, and the ventilator capacity, because we're keeping a very close eye on making sure that we have those capacities in place, not just in Morgantown, but across the state. But these are the metrics we're using at the state level too.
So I'll just add, when we look at those metrics in working with President Gee and our Board of Governors and as a leadership team, we know that there are risks to being on campus this fall. And we also know that there are risks to not having any classroom activity or being online in that capacity. And so we've talked a lot about the risks of being on campus. But if we go online, we also know that there could be some potential negative impacts as well, or those risks may not be sufficiently mitigated. And so we know, for example, that there'll be a number of our students who will be in Morgantown and will do their online coursework from Morgantown. And so we'll still need to have a number of these policies in place. Additionally, we also know that our students overwhelmingly prefer an on-campus experience. And so we may have some of those students who decide to take a gap year or maybe walk away from a 4-year degree. What we know, and it's not on the point of the finances of the university, we'll work through what we need to. But what we do know is that those with a 4-year degree or a graduate degree, over their lifetime, they earn more, they're healthier, they provide more tax revenue for the government, they're less likely to be in jail or have a substance abuse problem, they are less likely to be dependent on the government. And so there are a number of metrics that we know that are going to have a negative impact on students if they decide not to go to school because of a lack of an on-campus experience. And so we also know, for example, in the K through 12 realm, which would certainly continue on through our kids who are coming to college, the American Pediatric Association has recommended that the social interaction and being in school this fall is something that we will greatly miss and have significant impacts on a generation of students if we don't pull off things for an on-campus fall. So we're balancing all of those things about what are the risks of being online and what are the risks of being on campus. And also we're looking at what mitigation strategies we can deploy to reduce that risk. And so we know that mask wearing and testing and contact tracing and plexiglass and washing hands and a number of those things can really help reduce that risk. And it seems like almost every day with the landscape changing, as a leadership team, we're balancing all of those various interests and the positives and negatives of being on campus versus being online for the fall. and to trying to determine what's best for our university community, which includes our students, our faculty, but also the Morgantown area, Beckley and Kaiser and the areas that we live in. So it's really a complicated analysis that we're trying to weigh in determining how we best move forward as a university community. Again, taking clear guidance from our university experts as those metrics, the positivity rate, the rate of increase in ICU and ventilator use, and our R0 values.
All right, great. Thanks to all three of you. Rob, I'm going to stick with you for this next question. It says, in many classrooms and offices, there are no windows or they cannot be opened. How is building air circulation being adjusted to minimize spread?
So two things. One, we have been going through the process of evaluating our HVAC systems across our campus and looking at airflow. As our buildings have been upgraded or newer buildings that have been designed, one of the things we do is we work towards an efficient airflow for our students and our faculty to make sure that they have the best air possible. And so we're going through this summer and looking at airflow to see that it's at sufficient levels. For many of our units, we have the ability to increase the amount of outdoor airflow that circulates through our buildings, and we're making those adjustments. Additionally, we are working through and looking at whether we can upgrade filters or whether we need to increase the rate at which we replace our filters for our campus. Additionally, we've been working with the National Guard, and they've been working with some technologies in instances in which we would need to, that we would deploy sprayers that could go in and help clean HVAC systems as appropriate, or if we would see deteriorating air conditioning systems, or that filtration is not working the way we would want it to.
All right, I'm going to stick with you for the next couple of questions, Rob, so settle in. How often will employees and students have to be tested?
So we're going to do the initial test of everybody as we've indicated. Right now, given the conditions and the growing rates that we have seen, we're actually discussing right now how often folks will be tested. I mentioned 3 groups earlier: 1 athletics, 2 residence halls, and then 3 areas where there's musical performances or classes involved in instruments are targets for routine testing. And so in the coming days and weeks, as we see the landscape, we'll make a determination as to how often testing will be. It will not be, for example, once a week or something like that. It will be more routine surveillance where we'll test several hundred perhaps a week as we work through the semester as conditions permit. But again, we'll be focusing on those areas where we're trying to reduce spread or focus on populations where we think spread is more likely.
Okay, great. And the next question for you is, why are furloughed employees being tested after they return to work? If they are positive, wouldn't this risk exposure to others?
So really good question. Right now across the country, to get a test by and large, it requires a doctor's order, and we're testing folks who have reason to believe they're symptomatic, or they are symptomatic, or in some instances through contact tracing. There are some free testing that goes on the weekends that folks in our community have taken advantage of. The reason I bring that point up is when you think about someone getting a test, now mostly it's because there's reason to believe that they have COVID. We're actually one of the few institutions in the country that is testing every student, faculty, and staff as they come back. And so we're testing a number of folks who we know that are going to be negative and are not symptomatic. And it's really a precautionary measure that we do that. And so in that instance, for our employees and students who are asymptomatic and do not have COVID, this is really, again, an extra level of protection. And so when you think about it from that instance, we actually have folks who are doing research and are taking care of our campus right now. And so what we're doing is we're saying, in the run up to campus, we want everybody to get a test to try to catch that result. And so in some sense, that scheduling date when someone is getting a test is just that test date. It's not designed around our belief that this person has COVID and they need to to isolate themselves. What we've indicated is, as we move through that run-up, we do want folks, until they get that result back, to be extra careful and cautious for social distancing. So that's the reason why, we haven't started testing for our employees who return to campus, but they are required to stay more than 6 feet away. They are required to wear a mask and do those things to try to prevent that spread.
And to follow up on that, Rob, if an employee has been on campus and they get the test, do they then need to isolate, or can they continue to work and just continue to follow those guidelines until their results are known?
So they will continue to do their work until their results are known. And again, follow the guidelines that we've indicated of wear your mask, stay 6 feet away from others, avoid large crowds, avoid the 3 C's, and continue the protocols that we have in place right now.
All right, one more question for you, Rob, and you can take a break. So for employees that are not in Morgantown, perhaps some of our faculty and extension around the state, will there be alternative locations throughout the state for them to be tested?
So for those folks, we will have testing, as I indicated, in Kaiser and in Beckley. And so we will have those 3 locations. Logistically, it would be really difficult and really make it next to impossible to pull off the testing we're doing, to set up testing in, half or all of the counties. And so we will be asking those employees, if they want that test from those communities, that they'll need to do it in one of those 3 areas.
All right, great. So I'm going to let you take a break, and I'm going to pivot over to Dr. Coben. The question is, I read the FAQ that says face shields are appropriate in place of masks in certain situations. What are those situations? Because I find the face shield much more comfortable and easier to wear for longer periods.
Right. So the face shield is an acceptable, we think, alternative to a face mask if someone is particularly having difficulty wearing a face mask for sustained periods of time. And it would be one of those situations where through accessibility services, we would do an evaluation. Someone would request the use of a face mask that could be approved through that mechanism.
All right, great. So Rob, coming back to you, there's still lots of questions regarding testing. It asks, if a student is tested in their home state, are they still required to be tested again when arriving on our campus? Just want to clarify the process.
Yes. So even if you've been tested back home, we are requiring this free test for all of our students when they return to campus.
Okay. And another question for you, Rob. Oh, I'm sorry, Clay, go ahead.
So just to add a couple of things. So we know that the virus test, the COVID test, is good for the day that you take it. And we also know that, a good amount of COVID is spread by a few people who have the disease and oftentimes don't know it because they are in that pre-symptomatic time. So making sure that we are being very judicious at measuring the status of all of the students that repatriate back here in Morgantown or on our other campuses becomes important, because even if you were tested a couple of weeks ago, things can change. And because we're bringing everybody back together, the idea would be to try to reduce those people that might come back and not even realize that they have COVID, to try to make sure that they don't involuntarily or spread to other people, even if they don't know that they have the disease yet.
I'll just add one thing to that, and that is, as Rob mentioned, there is a questionnaire that people will be completing as they register for the testing, and as part of that, we'll be asking, in fact, whether or not they have been previously diagnosed as having COVID-19. If someone has had a documented diagnosis of COVID-19, they'll be contacted and we'll work with them. We may not require them to be tested because oftentimes those test results can remain positive for quite a long period of time, even though they're no longer infectious. So I just wanted to add that one caveat.
All right, great. Thank you. Thank you all. Rob, another question regarding testing. It says, will there be testing options for those who do not have a car? Is there a carless walk-up option permitted?
So for the carless, so at the rec center and at Erickson, they are actually indoors, so they're not car drive-through. The Coliseum site is a car drive-through site, but we will have walk-up lanes at the Coliseum.
All right, great. And this is probably for both you, Rob, and Dr. Coben, and probably Dr. Marsh as well. But it says, how accurate are the tests, and are you confident in the results?
I can start that off, and we'll invite the others to comment as well. As Clay mentioned earlier, the test that we're using is one of the approved CDC, FDA tests for diagnosing COVID-19. This test is in use at locations throughout the country, so it's certainly not unique to what we are doing. The accuracy of the test, I wish we could give a single succinct answer to that, but there are in fact many different things that influence the accuracy of the test, including, for example, where someone is in the course of their disease when they get tested, how exactly the test is performed, how the swabs are handled after the test, and how the sample is transported to the testing facility and to the lab. So there are a number of factors that influence the accuracy, and because of that, it makes it really difficult to give a single precise answer. I will say that, we know that there can be false negatives, people who are in fact positive, who are not detected on this test, which is why it's very important for people to continue to monitor their health, to continue to wear face masks, and to continue to socially distance, even if they've had a quote negative test, because it's important that we realize that there's a potential for a false negative. There are also potential false positives resulting from this test. And in those cases, we will work with people, all of those who receive a positive result. We'll continuously follow up with them to determine the length of quarantine that they might need to go through, and whether or not we would employ any repeat testing under those conditions. I don't know if Clay or Rob want to add anything more to that.
Yeah, if it's okay, Rob, I'll go next. So just a couple of sort of additional points to back up and maybe even further clarify what Dr. Coben talked about. So there's an article in the Annals of Internal Medicine that basically tracks the number of days that a person is post-infection and how quickly that test becomes positive, because the test is really determined by the amount of virus that you have in that area of your nose or in the back of your nose as we used to take those samples. And it turns out at about 7 days or so, about 65 to 68%, as I remember, of people who have COVID-19 will test positive. On day one, after you've been exposed, nobody tests positive. So part of this then is giving enough time for an exposure to get tested so that you are likely to be positive if you are positive. This test is a viral RNA test. It tests the genetic material of the virus. And therefore, there are reasons why you may not test positive, even if you have the virus. Some of that is how many days, that you've been infected, how much virus you have in your nose. But in general, although I think Dr. Coben is correct, it can be false positive. But in general, if you're positive by this test, we would believe that you do have COVID. And that, as we said, the majority of the spread is by a small group of people. About 20% of people with COVID will spread COVID to about 80% of other people. And about 70% of people with COVID will spread to nobody else. So if we find people that have that test that's positive, it's really important for us to make sure that we are both, watching them for further symptoms, but also trying to remove them from this group activity so that they don't lead to the spread of a lot of other people. Because this compounding effect of the COVID infection, this logarithmic effect, as I mentioned, 99 days for 1 million people, 53 days to 2 million people, 28 more days to 3 million people, you can see it's amplifying, and we want to keep that from happening because that's how surge happens. So these tests are pretty specific, meaning if it's positive, then we believe that you are positive, that you have COVID-19. But if it's negative, it could be a false negative, and that's the reason why we have to keep following people.
And just to add to that, Sharon, so I think that as Dr. Coben and Dr. Marsh indicated, given virus load, if you are in the early stages of COVID-19, you may not have enough virus load to test positive. But taking a step back in the what I would look at as sort of the layman's, hey, is this reliable? Are we going to get good information from these tests? Assuming we get the good nasal swab, which we believe we're trained to do, the tests themselves are accurate and reliable. And so we do think that this initial test will absolutely allow us to find folks who have COVID and allow us to take appropriate quarantine and isolation as we start the semester. And so we do have a lot of faith that the tests themselves and the technologies is something that we can rely on, generally speaking, for those results for the campus.
All right, great. Thanks to all three of you. And Rob, I'm going to ask you the next question. There has been a lot of news coverage lately about surges in campus environments related particularly to the students going to bars or having house parties. Can you talk a little bit about the work we're doing with the Morgantown community to try and mitigate those situations here?
Yes, we've had discussions with both the city and the county and some local business leaders on what we can do to help reduce the spread. So, you know, in Mon County over the past week, we have seen an increase in cases. And of course, our students are not back for the fall. And so it's been a combination of folks returning from vacations and folks going to bars, folks at parties, and any number of things. What we know from Dr. Coben and Dr. Marsh is that outdoor is better than indoor. And a lot of people in indoor crowded spaces without masks can be really difficult. And so that's why we've been really glad to see that some of the popular establishments in Morgantown after the recent spike said, hey, we're going to go carry out only. We know that this is something we have to all work through together. And so I do think there's a common sense of some of some of our business owners and colleagues who have taken that step back. It is also true that we know that if our bars are operating the way they do in a normal year for the university, the likelihood of significant spread will increase dramatically. And so we do believe we're going to need to work with the governor's office, with our local businesses, and with our local governments to develop additional mitigation strategies to try to reduce the spread. And so we don't want anybody to not be in business. We don't want to go back to the hammer where we're all shut down. But as we do work through this semester, given the environment we're in, we are going to have to take, and the university is going to push for additional mitigation strategies to try to make sure that we limit community spread as we move forward. And it's just, unfortunately, it's one of the realities that whether we're online, we're going to have more kids here this fall. You know, whether without our kids, we've seen the spike in this area, and that spike may continue, and we may have to take additional remedial measures as a community. I think the important thing is that we all sit down and work through it together and come up with some common sense goals so that long term we address this and deal with the pandemic.
All right, thank you, Rob. This next question is for Dr. Coben. It says, if a student in a class of 200 tests positive, will all 200 students have to quarantine?
Right, so no, we would not expect that to be the case. Again, recognizing that what we'll be looking for are those close contacts, as I mentioned. So, you know, one of the things that I know that our provost office and our academic teams are working on is mapping out student classrooms so that we can see who has been seated in certain locations and who may have been seated more closely around them. As the contact tracing investigations are undertaken, those will be the things that we'll be looking for. So the short answer is no, we'd be looking for just those individuals who are within that 6-foot radius of the person who's been infected.
Right, great, thank you.
If I could have one thing, Sharon
Sure.
and Jeff, that we know as well that the more mitigation strategies that we follow, the less likely people will be infected by a contact case. So wearing masks or face coverings or face shields and distancing is a further protection from having spread happen. So we do believe if we follow those guidelines effectively, then we can protect people in classrooms as well.
Great, thank you, Clay. And actually, we're right at the 11:30 hour, but I'm going to ask one more question of Dr. Marsh, and it says, are there extra precautions that students, faculty, and staff with underlying health conditions that would make them more susceptible to serious effects of COVID? What can they take extra precautions, opt in or opt out of, to avoid extended exposure?
Well, I think that, this is what at least we hope to communicate, that for everybody, we should be, diligent and vigilant and focus on protecting ourselves and each other. Good common sense is also a great guide, that if you have an option to do online versus in person, and you have significant risk factors that, include really for us today, more vascular based problems, like if you have high blood pressure, if you have heart disease, if you have diabetes, obesity, certainly age over 65 or over 70 is a risk factor. Intrinsic lung diseases like, asthma, chronic lung disease from smoking, etc., all can affect your risk, but really the blood vessel based diseases are the ones that tend to delineate people that might have more significant problems. So if you don't have to come to campus, don't. If you can stay home and work from home or take classes from home, then of course you should do that. And if you come out, make sure that you are effectively, staying physically distanced away from people. Wear your mask. If you are looking at an environment that doesn't look safe to you, then don't go in that environment. And certainly we would always want to try to facilitate, whatever you need for your personal safety and well-being. We would want to help you find that. But I think it's really good sense, and whether you have underlying health problems or not, you should approach these protection mechanisms exactly the same. Wash your hands, don't touch your mouth, your nose, or your eyes. Keep physically distanced, wear a face covering, be in environments where others are doing the same, be outside versus inside, and avoid constant contact with people that you don't live with. So that would be my suggestion. I don't know if Jeff, you or Rob have other thoughts.
So Sharon, the only thing I would add is that, if you're a faculty member or a staff member, we've already launched for faculty the ADA accommodation website. And so I know that the appropriate folks are already reviewing some of those requests that have already come in. If you have questions, and I think it's on this slide presentation, which will be, we mentioned previously, there's also contact information for the Office of Accessibility Services in working through things. But just to reiterate from Clay's perspective, the plexiglass, the masks, the hand sanitizers, a lot of things that we're deploying, and the good common sense of just staying away from others when you can avoid it, are really good steps for all of us, whether you have underlying health conditions or not, to follow. But again, we do have those university tools within the Office of Accessibility Services and ADA to help those folks with underlying health conditions work through what's appropriate.
Great, thank you, Rob. Dr. Coben, anything else to add to that? Oh, all right, great. Well, we are at 11:34, so I'm cognizant of everyone's time. So I do want to thank everyone for attending today's Return to Campus conversation. I know there are a lot of questions that we did not get to today, but I want to assure you that we'll continue to answer those, and they will be posted to the Return to Campus website later on, if not this afternoon, early tomorrow. So just keep in mind to check that if your question did not get answered. On behalf of Drs. Marsh and Coben and Rob, we appreciate the opportunity to be with you here today to continue working through how we're going to return to campus this fall. For more information, be sure to visit the website, wvu.edu Return to Campus. And if you have additional questions, you can continue to send them to returntocampus@mail.wvu.edu. An archived version of this conversation will be available on the Return to Campus website. And please plan to join us next Thursday on July 16th, again at 10 a.m. for the next installment in our Return to Campus conversation series That conversation will focus on what employees can expect when they return. Please watch eNews and UNews for webinar details. And again, thanks for taking part in today's discussion. Please continue to stay safe and be well.